Alright guys, today we have something very, very special. You're going to follow me into the OR and meet Patrick!
Hi, how are you
guys all know Patrick. And Patrick is going to show you exactly how a patient goes off to sleep. So for any of you that have any anesthesia concerns, no you're not awake, no it doesn't hurt, no it's not scary because we have this guy!
Exactly.
Woo!
And so we're going to show you how an IV is placed here at Allure and demonstrate to you that it's really not very painful at all and that we're here to provide you a good experience today.
Yay!
So I'm going to be showing you here at Allure how an IV is typically placed, and there's a few simple supplies here. We have gloves, we have gauze, we have a couple different IV catheter sizes. We use alcohol, we use numbing agent, and this makes a huge difference in IV placement. We have a clear dressing and a tourniquet. So we're going to place a tourniquet on the forearm, and it is always a little bit on the tighter side. So for an IV experience, this may be the most uncomfortable part. And go ahead and squeeze my fingers many, many times. That helps dilate the veins and makes them nice and plump. And as you can see, there's this lovely vein becoming nice and dilated. Another way to help with the dilation process is to tap the vein. And as you can see, it's becoming larger and larger. We're going to open up some alcohol, and the purpose of alcohol is to cleanse the site. And so when the alcohol, as it is drying, it kills the bacteria that's present on the skin, because we don't want this to be a potential site for an infection. Here's a little bit of local anesthetic, and this is a numbing agent. And as you can see, the tip of the needle is very, very, very small. So smaller the needle, the less pain there is. For today, this is going to feel like a mosquito bite. All right, so the numbing agent is at the area already has been injected and is at the area where we're going to place the IV. And so there should only be some pressure that is felt. And there we go. We just slide the soft plastic catheter in, and that's all that remains within the vein because the needle does not remain there. And then we release the tourniquet, we connect up the IV, we place the dressing on, and look at that, we have success. So we're going to be placing the patient off to sleep. We have all the monitors on. I've also given some relaxation medicine. The goal is to always have everyone be nice and relaxed before going off to sleep. So we encourage everyone to take in nice deep breaths, in and out. It's so important to have the lungs filled with oxygen before going off to sleep. So once the patient is off to sleep, we do place tape over the eyes, and the reason for that is that it maintains the closure of the eyes. It maintains moisture, prevents the corneas from being scratched. Now today, for this patient, we're going to be placing what is referred to as a nasty airway. And it's this device right here. As you can see, the placement of the airway device is painless, it's easy. The patient is completely off to sleep before we place anything into the airway. Having air flow into the lungs, along with anesthetic gas, that's keeping the patient fully off to sleep. And so this is referred to as a general anesthetic. There's all different types of anesthesia, but here at Allure we give predominantly general anesthesia, where you're completely off to sleep.
And do you ever leave the patient room once the patient's in the room?
Ever. I am with you from the very beginning to the very end, to when your care is being transferred over to one of our fabulous nurses.